Ever wondered what powers your body's cells? Meet triglycerides, the unsung heroes behind the scenes. These are a type of lipid or fat found coursing through your bloodstream, serving as the most common type of fat in the body. They are essentially energy powerhouses, providing fuel to cells all over the body. Structurally, they consist of 3 fatty acids attached to a glycerol molecule. Besides providing energy, they also have a protective role, insulating and safeguarding our organs. So triglycerides are vital for our bodies, but where do they come from? Triglycerides can come from our diet, or our bodies can produce them, but how much is too much? You might have wondered. Well, dietary sources of triglycerides include many foods, especially those high in saturated and trans fats, such as red meat, full-fat dairy products, and fried foods. Additionally, our liver can whip up triglycerides from excess calories, particularly from sugars and alcohol. Now, when it comes to the levels of triglycerides, we have 3 main categories. Normal levels are less than 150 milligrams per deciliter of blood. If you're between 150 and 199, that's considered borderline high. Anything above 200 is high and increases the risk of heart disease. So, maintaining a balance is essential. Too much of these fatty molecules and you're looking at some serious health complications. High triglyceride levels can lead to serious complications. Let's delve into that. When triglycerides are too high, they can wreak havoc on our bodies. Elevated levels may contribute to arteriosclerosis, which is the hardening or thickening of artery walls, thus increasing the risk of stroke, heart attack, and heart disease. Moreover, high triglycerides could lead to pancreatitis, a severe and potentially life-threatening inflammation of the pancreas. These elevated levels are often a sign of other conditions that increase the risk of heart disease and stroke, including obesity and metabolic syndrome. Metabolic syndrome is a cluster of conditions that includes too much fat around the waist, high blood pressure, high triglycerides, high blood sugar, and abnormal cholesterol levels. Additionally, high triglyceride levels boost your risk of various heart and vascular diseases. But what causes these levels to spike? Several factors can cause high triglycerides, but the good news is there are ways to manage them. High triglycerides can stem from excessive alcohol use, a diet high in sugar and simple carbohydrates, unmanaged diabetes, certain medications, and diseases such as kidney or liver disease. Even lifestyle habits like smoking and lack of physical activity can contribute. But don't lose heart. You can manage your triglyceride levels through a healthy diet, regular exercise, weight management, and possibly medication. Limit intake of saturated and trans fats, sugars, and alcohol. Engage in moderate-intensity aerobic activity and maintain a healthy weight. In some cases, your healthcare provider may prescribe medication to help. Understanding and managing your triglyceride levels can greatly impact your overall health. Give yourself the best chance at a healthy life by keeping your triglycerides in check.